Hello, my name is Bob Cobley, and I'm the owner of Spectrum Lasers. I am going to conduct a Zoom S-1 training. Now, some of what I'm going to go over is going to be pretty obvious, but I'm going to go over it anyway, just to make sure it's covered. So I'm going to screen share, and hopefully you're going to all be able to see this. Now, as you know, this is our brand new laser. It's been out a little over, well, it just came out in April of 24. A lot of time has gone into this, a lot of research. We've been in business since 1998, and we're very happy about this laser. So um, we recommend that you have your laser on a cart, or if it's not on a cart, you want to, once you're using it with a patient, you want to clean it, get it ready for the next patient, even if you put it in a cabinet. So if it's ready to go and it's easy to just plug it in and use it. Now, this laser, there are no contraindications, pregnancy, pacemakers, nothing harmful at all. The only, except for this wavelength is attracted to pigment, which is your iris and your pupil. And that is why you have to wear the safety glasses. It comes with two pair of glasses and a pair of goggles for the patient. The energy comes out with the laser tip in a cone shaped like this, so it does not shoot across the room. FDA, and that's why open bay is just fine. FDA says everybody within 3 feet needs to wear the glasses. Now, laser's been in dentistry since 1991 with 0 recorded accidents. And we know someone has done something very careless, but no one's ever been hurt. So let's say mom wants to watch the procedure. Just stand more than 3 feet away. And she's not going to be hurt anyway. I have many doctors that don't wear their glasses. They just don't wear them. I don't like them. But I recommend definitely the chair side wear them and have the patients wear the goggles. So the laser itself, we spray it, wipe it down, disinfect it, wipe it down. You can wipe down the fiber itself. I'll get to the handpiece. Well, the handpiece here, this is a different handpiece from our old laser. Never remove this nut. Inside the handpiece is a little white pressure fitting. The pressure fitting is what grabs onto the fiber and keeps it from slipping. This, you can spray this, wipe it down, or it can go into any autoclave, but just loosen this nut. Don't take it off. If they take it off, that pressure fitting is going to get lost. And unfortunately, we do not just have extra pressure fittings. You have to buy a whole new handpiece, and handpieces are $199. Now, also, our previous lasers had little plastic cannulas. It no longer has that. It has this little metal chip, comes with 3 of these, which is autoclavable, or you can wipe it down. So you don't have to deal with ordering those plastic tips. Now, you can pen this more if you like it that way. So now some of the energy can escape the sides of the laser fiber, and it can heat up this little metal cylinder here. So you might want to spray a little water on it, maybe a little damp 2x2. A little water might cool it down a little bit. We just want to be careful around the patient's lip. So no maintenance at all for this laser. Now, also, this is the formula for the topical. Now, I would have emailed you the orthodontic laser procedure guide, and on that guide at the bottom is this formula. It's also on my website, the website training page. The password is member, but this is the formula. I recommend that you have this made locally, not in the place in California that I used to recommend. And you want to order maybe a 15 to 20 gram bottle instead of, single patient application, which some of these will want to sell you. Much more expensive. They'll tell you this is a 1 month shelf life, but it's a 6 month shelf life. So it's really strong. It works great. Any fibers, parts, any of that kind of stuff, just call us. And any issues, etc., just contact me. Safety, we just went over. Carbonizing the end of the tip. On this procedure guide, we've gone over the handpiece, and well, actually, let's go to this here. this is the video that I would have sent you the link to. It's a video on how to work the handpiece and use the micro stripper and how to carbonize the tip. I don't want to play it now. You already have the link. But when you carbonize the tip, see, this wavelength is attracted to pigments. So when we burn a little pigment on the end of the fiber tip, it creates a hot tip. It won't cut if you don't do this, any diode laser. And you can't overdo it. You get as much carbon on the end of that tip as you want. You can use the articulating paper or just an ordinary Sharpie. Put the foot pedal down and coat that tip. So remember, you can't overdo it. Now, over here, now, once you've watched this video, hopefully you already have, but it'll tell you about the handpiece and how to use the micro stripper, how to cleave it, and conditioning the end of the tip we just talked about. Now, the topical, well, we'll get to that in a second, but the settings are right here. Number 3, for normal regular tissue, it's 1.0 to 1.2. We do everything in the pulse mode. So when you're up here, you press the pulse button. It'll say standby. You have to press that button so it says ready. Then you put the foot pedal down, and then the laser works. And in the paperwork I've sent you is the foot pedals do not have a battery in it. As a AA battery. For some reason, we're not allowed to send batteries. FDA regulation of some sort. These little arrows is how you do your setting. The pulse amplitude of this laser is 10 watts per pulse. Our old lasers were 3 watts per pulse. So this is more than 3 times more powerful and 3 times faster than our previous laser. And our previous laser is pretty much considered the best laser in the world. So that's our, so we turn it on in the back, and you'll see in the video, there's a rocker switch. And then there's a little red knob you turn clockwise, and it lights up. It'll say ask for a password. It's all zeros, and then you press OK, and you'll get this screen here. Now, also there's an audio tone button right here. The audio tone, you can turn it down very low, or you can turn it off. The reason we have that is so that the patient doesn't have to hear the audio tone. Sometimes they won't even know that you're doing the procedure, but sometimes they might hear that tone and tense up. It's kind of not really needed, but you can have it on or off. It's up to you. Now, when we get to our procedures, there is a little video. I think I might play this. I probably sent it to you, but let's see here. Our normal setting 1.0 to 1.2 for regular tissue, but this lemon here is really dry. So I'm going to go to 1.5. We've already activated the tip on articulating paper. And what we're going to do is we want to hold this in one place until we feel it penetrate. Now it's penetrating. And then we start moving it slow and steady with light contact and let the laser energy do the work. Now, right now, I'm going across this. If this was a cuspid exposure, I would be done right now. We keep going with that incision until we get down the tooth. Remember, we can touch tooth, we can touch bone, we can touch metal. Now, I'm going to go underneath here, underneath the flap, and kind of expose it all. Okay, so let's go back. Oh, did I do something wrong here? Okay, here we go. There we go. All right, so let's say we have a procedure like this. We're gonna apply our topical, kind of like you would etch, liberal amount, of course, isolate the area. We're gonna time it for 4 minutes. Now, it doesn't have to be exactly 4 minutes, but 4 minutes, then they're gonna wipe it off or suction it off. They're not gonna rinse it off. Rinse it off is gonna numb out their throat, not gonna hurt them, it's gonna scare them. Then we're gonna let the patient sit for about 5 minutes. So in other words, about 10 minutes. When the assistant applies a topical, they'll be ready for you in about 10 minutes, but the patient will be numb for about 20, so you don't have to rush right over. We're going to remove that topical, and then we want our target tissue to be wet. And I'll show you in a video, but we're going to hold the fiber tip pretty close to perpendicular to the tissue in light contact. Hold it in one place till it penetrates, and then we're going to slowly, slow and steady, make an incision around that perimeter of our opening. Nice and slow. Now we can touch tooth, we can touch bone, we can touch metal. Now we're all the way to the tooth. We're done. We're going to grab this little flap with, forceps or cotton pliers, undermine the flap with the fiber, lift off the flap, little cotton pellets of water, dry up our margins, clean it, and bond. When you get the hang of this, it'll take you maybe 25 seconds. Very simple. Here's another one here, Dominic Bacchus. You just do these all the time. It might look like that's a big deal, but that's really 25 seconds. Should shoot. Now, let's imagine it's 3 millimeters thick. Well, then it's not one or two. It's several passes until you get down to the tooth. I was with Dr. Pitts with some residents, not this case, but just like it. And we opened it up only to find out it's not tooth structure, it's bone. So Tom said, you take a hand piece and just shave the bone off, or take a hand instrument and scrape the bone, or just leave it, it'll break through the bone. But we do not cut bone with this laser. Now, also little access gingivectomies like this, we just need more room. We do not have to worry about biological width because the tissue will just grow back, except for the cosmetic cases, which we'll get to. This kind of thing here, we just need access for a bracket. Here's for Dr. Sarver. He doesn't really care what the margin looks like right now, because you're going to take care of that. We're just getting access. Here is a doctor in Memphis. He's going to do a couple of procedures. I think he's moving the fiber tip a little faster than what you should, but he is going to do 2 exposures in about 1 minute.
I don't like to expose the whole tissue. I like to just probably do the lower third so that I can get a bracket on it. A little bit more on this side. And that'll give me sufficient room now to put a bracket on it too. So we'll do the left side.
So the assistant's got the suction right there to collect any plume or any odor. The assistant will have a damp 2x2 that if tissue globs up at the end of the fiber tip, they can either wipe it off. You can either wipe it off on the gauze or flick it into the suction. And you notice they sprayed a little bit of water. Just want to get it wet. Now, let's go back to these settings we talked about. Normal tissue, 1.0 to 1.2. Fibrous tissue, 1.4 all the way to 2.0. What we want to do is avoid producing black charcoal. That's a result of too much energy. That does not hurt the patient, but you can't laser through the char. The laser energy has trouble penetrating through that char. So if you are doing thick fibrous tissue and you need to increase your power and you're producing char, just have the assistant with a microbrush and they're constantly cleaning it so that you can get in there to the tissue. Now here's an example of, we're going to start where we want to finish. We aren't going to start at the margin and work our way up. Now see all that carbon on that tip? And this is, obviously before we're placing the brackets, we're just getting access. Really slow and deliberate. A little bit of pressure, not too much. If it's thick tissue, then you've got to apply pressure. And we're just going to excise this piece. mean, that's producing a little bit of char. That's not a big deal. And just excise that whole piece. No bleeding, no discomfort. Here's an example of holding a fiber tip perpendicular to the tissue and slow and steady.
If I ever feel myself thinking a little bit, just stop and do something else. Yeah. You gotta follow it.
Okay, after you've done several of these little simple little things like this, that's what I want you to start out doing these. Nothing can go wrong. I mean, you want to be an attached tissue, but they're really simple. And once you're comfortable, laser tissue interaction, then we're going to graduate to what Dr. Pitts calls the wow factor, which is this. We talk about this in the Pitts Masters. The braces come off, we have this. We don't want that. We want this. So it's your job to let the patient know. Now, when you let them know, you might want to let them know in an initial exam consultation that you may be doing this by showing them a picture, or somewhere along the line you'll let them know, or you can wait to the end and say that we're not finished yet. We need to use our special laser and a little numbing jelly and shape your gum tissue and make it look beautiful like this. You can go to my website, you can copy and paste cases till you have your own. Show the patient, this is what we're going to do for you. Now, the sooner you can do it, the better, because the less time the patient is walking around with a not very good result with your name on it. So ideally, if you can do it in the same appointment, the braces come off. I know it's a long appointment, but you're finished. There's only, retainer, there's only one retainer, but then you're finished. Or have the patient back soon. I know that some doctors wait a month or two. It's just, we've gone over this, and it's just the sooner you can do it, the better. And then I also recommend in a new patient exam, the type where they might be going to 2 or 3 different offices to see who's going to do their treatment. Let them know that you do this here in the office. We don't refer you to a periodontist for $3,000 to $5,000. We have a special laser and a little numbing jelly, and we're going to shape your gum tissue and show this. Because if they go to the doctor down the street and the doctor doesn't let them know that they do it, then the patient has no idea that they do it. And a lot of times the patient doesn't even know this is possible. Like Dr. Pitts says, the patients, they don't know what they want until you show them what they can have. So, you see this kind of thing a lot. You can just trim it up and make it look beautiful with this laser. So how do you do these cases? When I lecture, I tell them, the first thing you do is you got to buy one of my lasers. But then I have you go to our training page and read this article by David Sarver, where they talk about, height to width ratios of the teeth and what you want it to look like, ideally, when you're finished. So you have that vision. What we're going to do is we're going to measure in the sulcus, and we want to leave 1 millimeter of pocket when we're finished. If we do that, we're not violating biological width, and it will stay exactly where you trim it. It's not going to rebound. That's where it's going to end up. So you've got a case like this. The first thing we want to do is take the laser and crosshatch and thin these papillas. Now, papillas are more fibrous. So this here, you'll learn, but probably 1.5. We just want to thin those down, just shape them down. Then we're going to go back and do our margins. And you've already probed, so you know how high you can go. And we're going to start at the central and shape it how we like it. Sarver says the zenith, the highest point, needs to be about 1 millimeter distal on all the teeth. So we got the central how we like it, and we're going to do the other central to mirror it. So it's mirrored, identical. Then we're going to go over and do the canine the same height as the centrals, and the laterals a little shorter. And then we're going to go all the way down the corridor. Every case I'm going to show you, we go all the way down the corridor because we're widening everybody out and showing our teeth. So we want to show those teeth. Now, we're going to we used to have you take a cotton pellet, the assistant take a cotton pellet, clean this all up. It takes 15 minutes. Now we take a toothbrush and we dip it into hydrogen peroxide and brush this up, and it takes about 5 seconds. And then we're gonna take a vitamin E gel cap, ordinary over the counter, break it open, on your finger or Q-tip, just massage it in the tissue, make them look pretty before they leave the office. And again, there's no discomfort. I mean, 99.5 patients out of 100, no problem at all. We're going to give the patient 3 or 4 vitamin E's for post-op. And tell them that about once a day, I want you to take the gel to break this open, put it on your finger, massage it in your tissue. It's good for healing. And say brush normally. Try and avoid salt or citrus things might make it sting. Say you're going to be completely healed within 7 days, but it's really about 3. But you want to give yourself some wiggle room. So here is smoothing off a papilla, just kind of smoothing it down.
Yeah. Okay, so the thing is up with this, yeah, that's not gonna heal right now, right? You have to come in and thin this patella out a little bit, okay? Does that make sense? Like not that. Yeah. Take it down.
Now this is important here. It's going to talk about black triangles.
And I'm very careful not to go into the papilla. I'm not taking where the height or the length of the papilla. I stop before I do that. Otherwise, you will create a quicker spot. I'll also kind of debug this just a little bit. Get good contours.
Okay, so for these kind of cases, the assistant's going to be in there with a microbrush, constantly cleaning. But again, what he said is he's not going to change the height of this papilla. We're going to stop before we get to the end. And we've been in business, whatever, 26 years. I've never really heard of a black triangle being a problem, but doctors ask me about it. Now, here is thinning down some tissue, a little bit of beveling.
Notice on the suction tip, you put a little carbide burn, and then a little spot right in the laser, the tissue that's on it. Now we're just a little bit thick right here, so I'm just gonna just do a little bit of cross section. Thin this tissue out. Stop. And you get a little here.
So just kind of thinning that down. Now, another technique for that is you can take your fiber, you can carbonize it so the carbon, the ink goes 2 or 3 millimeters up the side of the fiber. You can lay your fiber horizontally parallel to the teeth, to the tissue, the margin, and just ever so slightly just bevel it. But if it has any kind of thickness at all, then you have to use a tip like we just saw. Now here is, I think he's going to do the other central here.
So now I'm using the other side. So now I'm just trying to say a little bit, good. And I'm gonna match the left one to the right one. One thing that's really nice and it's gonna be a patient a compliment.
All right. So here's thinning down another pillow and a little bit of tissue beveling. Oh, here's that toothbrush I was talking about. Just toothbrush you have, dip it in hydrogen peroxide.
Good.
How do you open this? So then we just gonna go the water. I have to play everybody.
Yep. So now here's some cases. This is a David Sarver case. He sent me, orthodontically, this might be perfect, but it's not a good smile. Then he shaped up the tissue. Now it looks great. So many of those. Here's a Dwight Fry from Chicago. Before he had a laser, he'd be finished right now. He might refer them to periodontist, but they're not going to get it done. But now look at the difference. I mean, that's okay, but this is great. And these papillas weren't completely smoothed down, but they healed beautifully. Now, here's an example. Cod Bovinizer before he had our laser. This tissue is kind of chewed up, kind of bloody. It's because the laser he was using didn't cut very well, and he had to apply a lot of pressure with a fiber tip. That fiber is glass, so it becomes a scalpel. He's scraping it too hard and made it bleed. Now, it healed beautifully anyway. Now, and what he did here is he took this little girl from his short little teeth, longer, more beautiful teeth. A year later, same thing. It didn't move, didn't grow back. This kind of thing, you see these all the time. Here's one mid-treatment. We're just going to get access. Nathan Hansen, very young doctor. Seth Lucas in El Dorado Hills, California. Kind of up by Sacramento. This is a little thicker. So see, he's gonna have to thin this down with higher energy and more pressure with the fiber tip. Same thing here. We're gonna thin that down first. That's this is Vince Santucci in Kansas. I think this is beautiful. I had a beautiful case. Vince only had his laser a year or so, but he's just using it a lot, so he's getting very good at it, like this. So Vince charges $500. He figures it's going to take him 15, maybe 20 minutes to do this, and he needs to charge. I don't know what his fee structure is. I don't have any idea, but I said, okay, he figures 500 is acceptable. If he charges 3,000, they're going to decline the treatment. And I said, well, how many did you do last year? He said 150. Well, that's $75,000. And more importantly, it's 150 cases that are a lot better than if he didn't do this. So now here's a resident who's very little experience. This is a very nice case. This is a case here, just big bulky tissue. You just thin that all out. Now he is going to do hard tissue recontouring, but that heals up in it's maybe 3 days. But I mean, there's no agony here. I mean, the patient's fine. Another one, it's a little thicker. We want to thin this down first. This is some doctors do the recontouring before the braces come off, a few weeks before. And then the braces come off, they do a little touch up. Well, that's great, except for it's harder to do when the brackets are on. So that is one option. This is Jorge Gutierrez in Mexico City. Really good orthodontist. He didn't like this bump here in Tuno Centris. So he just smoothed it out, healed beautifully. Looks great. Trevor Nichols is really good at this, only because he does a lot of them. He also did hard tissue recontouring, but see, look at how precise that is. This looks like a different patient. I mean, this is amazing difference. Same with this here. Just all these. Now, here's a big guy with little teeth. Took care of that. Gummy smile. Here's halfway through. Another case here. Looks beautiful. Really nice difference. I don't know if you know Wasim Bousid in Algeria. Tom Pitts says he might be one of the best orthodontists in the world. He does these gummy smile cases that take a long time, 24, 30 months. And he does all that work and all that time. And then he ends up with this, and he doesn't want that. He wants long, beautiful teeth. So he recontours every case. And, it just makes a world of difference. This year I'd look at this and, that looks okay to me, but you guys can tell it's maybe a little canted, but just that little extra. Now here's a case he sent me. I looked at this and I thought, oh, wow, those teeth don't look lined up, but they were lined up. It's just the tissue. So when he lectures, he shows, cases like these, and then of course, this kind of thing that you all see. Here's from Dr. Frost gummy smile course that he has in Arizona twice a year. I think it's like a day and a half course, and you go in there and you know how to do it. And I was kind of surprised, being a layman that I am. Oh, gummy smile. Okay, I know what that is. Oh, you mean they could be canted? Yeah, I guess so. Makes it a little harder. His is Frost Smile Academy. Here's a happy mom that I interviewed.
And my son just had a laser contouring by Dr. Frost, and it was just amazing. I cannot believe it. I am stunned at how much better his smile is. When he got his braces off, it was a little bit of a letdown because I couldn't believe how small his teeth were, and I am just amazed at how his smile looks today. It's a different smile completely.
So what that told me is that she had no idea this was even possible. And the only way you would know, is if you told her. So she's very happy. And I was there, and her son just had short little teeth. Okay, another Steve Tracy's a doctor in Inland, California. All right, billing the dental insurance. Okay, there's a lot of ways to do this. I have, I don't know, probably 400 or 500 orthodontists that do bill the dental insurance or just charge. If you're going to bill the dental insurance, and sometime in the near future, I'm going to have a video on my website made by an insurance person, because insurance people know a lot more about it than I do. But basically, an exposure 7280, they want before and after pictures. There are some examples of narratives on my website. You're going to have to write up 4 or 5 narratives, and then you just reuse them and change the tooth number. You also need probing. So you need a probing chart. You need to probe just the teeth that you're going to treat. You're going to bill this for about $400. You're going to get paid about $300 per exposure, and there is going to be a copay. Now, for gingival recontouring, it's gingivectomy quadrant, 4210. Same thing, before and after the probing chart. In the narrative, it cannot say we want a more beautiful result. It's got to be some reason, a bacteria collector or something. And you're going to bill this for about 500 per quadrant. You're going to get paid about 300 per quadrant. I mean, if you do, I don't know, 200 of these a year, what is that? 100 a year is 100 a year is times 600. Is that 60,000? Yeah. So I asked Tom Pitts, I mean, how many cases would you recontour in a year? A busy office? 100? He said, oh, way more than 100. But now you might want to just charge, like I mentioned, of Vince Santucci. Now, here's another option. You got to figure out like this. Let's say you want to charge for this. You'd have the patient's photo on the screen, talking to mom. Well, little Jimmy's adult tooth is trapped under the gums. We see this quite often, and it will expose itself, but it could take 8, 10, even 12 months, and it's going to slow down treatment time that long. Our options are, I can send you the periodontist. Unfortunately, it costs probably about $2,000. Or here in our office, we have a special laser and a little numbing jelly, and we can expose this in about 30 seconds and get on with the case. Our fee for that is something like $300. See Nancy up front. And then they're going to say, well, I thought that was going to be included. Well, unfortunately, this laser equipment is expensive. So we do have to charge something. So we are saving you about a year of treatment time and over $1,000. And, I talked to my doctors about this. I didn't come up with this. So mom is not happy about this and is throwing a fit. Don't charge them. And just let them know that, we're not charging you. Now, that also might help later if you have to recontour the teeth and you do want to charge. Well, I didn't charge you last time. That's a lot for you to figure out how to present this, because I'm in the Pitts Masters and I hear some doctors are very, very wordy and they spend so much time explaining it, where others just do it. Keep things moving. Oh, and what I didn't mention before is what's really important about getting your laser after you use it. Have the assistants cleave it, clean it, get it ready for the next patient, either on the cart or in the cabinet. Because on a Tuesday morning, you see little Jimmy, and Jimmy has an exposure, he needs an exposure, but laser's not scheduled. Well, if you know it's only going to take you about 25 seconds, you could say, I'm going to do it right now instead of a whole nother appointment. Dr. Pitts is constantly talking about saving appointments. So if the laser is ready to go, but if you have to get it out, prepare it, all that kind of stuff, then the tendency might say, oh, a whole new appointment. So let's go down here. Now, this thick fibrous tissue. These cases are going to take a long time with a diode laser. Our other laser, the 450, is at least 3 times faster. But with the diode laser, what we're going to do, I'll show you. Let's say here, we're not doing this for cosmetic reasons. We're doing it because we want to move the brackets higher. This is how we do it right here. This is Dr. Pitts with the residents.
Now we need to get a chemotherapy. You know, what's that there on the, you want to. Yeah, I'm sure. Oh, there you go. That's so nice. That's a jam.
Now you notice he was applying pressure because that fiber was bending. But now how we're going to do these kind of cases, or even any of those thick cases like this, the first thing we're going to do, we're probably going to set it at 2 watts. And we're going to thin down these papillas. And it is going to produce char. So the assistant's going to be right in with the micro brush. You produce the char here, then move over a different area where she cleans up the other area, go back, thin this all down. Then we're going to do the margins. But these cases will take longer. This kind of case will take a really long time. The options are you can send them back to the dentist, say, try and get this inflammation under control. Dr. Frost told me that sometimes you wait 3-4 months, they come back, it's still there. So it's going to take a while. Or refer them, but if they'll get it done. Now, everything I've been showing is with topical only, although really thick like this, that's going to be some finesse there, because about halfway down, they're going to feel it. Then you have to reapply the topical. Case like this, injection for sure. This is Errol Yim out on the Big Island. He referred this palate exposure. Patient never gets it done. Patient keeps coming back in, so they figured, okay, break out the laser and do this. This probably took close to 10 minutes, but now they can get on with their case because he's not going to have it done by the surgeon. So here's one here. It's pretty deep. I mean, you could do this probably 10 minutes. Frenectomies, I'll play this if you decide to do frenectomies. They're pretty easy. We stretch that frenum. We start at the base. That's not our setting. You look on our guide, it's like 1.4. We're stretching that frenum. And we're moving higher with the fiber tip. And it's going to be a little diamond-shaped wound. And when we're finished, this wound is going to be about the width of the two centrals. Sometimes inside the wound, there'll be little strands that need to be severed. This, you know, you could finesse it with topical only, but pretty much need injection. Now they're going to be a little bit sore. You're going to clean this with hydrogen peroxide, give them 4 or 5 vitamin E's, tell them if they get anything stuck in that wound, just put the vitamin E gel in there. I think it's soothing. Now you see where he started in between the centrals, that there's a little bump. You're going to want to thin that down also. And we want to get this wound about the width of two centrals so it won't reattach. So this is an old, very, very old video. So that's not the setting. Now you'll see the healing here. And there's some other frenectomy videos on my website. Heals up nice. And I think that's about it. Any questions you might have? Lingual frenectomies. Not too many of you do lingual frenectomies. I was in an office, actually, Dr. Frost, he's going to do a lingual frenectomy. And he figures all I have to do is just sever this. He's got a little tool, kind of like a fork. And he's just going to sever that frenum and everything should be fine. But he severed it and the tongue did not release. So he had to go deeper and deeper and deeper. And he knew this patient is going to be uncomfortable later, like really uncomfortable. And he just didn't want to go there. So doesn't do those anymore. I would say, I don't know, probably 10% of you do frenectomies at all. But any questions you might have, contact me. We can do a live Zoom if you like. Anything. I'm here to help you. So I want you to enjoy your laser and good luck, and we'll see you later. Bye-bye.